Okay, hi, yeah. Okay,
It's on.
okay, so. Okay, we're going to begin our joint City of Corpus Christi, Nueces County daily press briefing for today, Tuesday, March 21. I'm Peter Zanoni, Corpus Christi City Manager, and I'll be speaking to begin this afternoon, and then our City County Health District Director, Annette Rodriguez, will speak. And actually, we're going to devote some extra time to Annette because she's going to go through the revised criteria to be tested. Now, we've been at this for several weeks, and things have changed almost daily from the Centers for Disease Control, and that is our guiding rule on who gets tested. But the testing requirements have relaxed over the weeks, and Annette did a great job today briefing City Council about the new requirements to be tested at our facilities and at the hospitals and medical providers as well. So we thought it'd be good to re-communicate that to the community. So those that are watching after my briefing, I would especially encourage you to listen to Annette, who will go over what is required to get tested. And then she's also going to spend some time to show you some of the testing instruments that we actually use. Just so we've talked about them a lot here. I know the county judge, Barbara Canales, has on several of her briefings. But Annette Rodriguez will actually show us the swab and the medium that you transfer the swab in, and the acid and all those other things that they use in our health lab. So she'll go over that. County Judge Barbara Canales will come up after Annette and talk about some of the update to the county orders and some of the things she's working on. Tomorrow at Commissioners Court, she'll be having a workshop with the commissioners and working with them to develop some additional potential policy guidelines for the community. And then with us today also is Mayor Joe McComb, and he's going to talk to us about certain scams, COVID-19 scams that are out there that we're aware of, and we want to make sure the public has some good information so they're not taken advantage of either financially or otherwise. And he does also want to acknowledge some donations that were made to the food bank, and so that will be his briefing for this afternoon. So with that, I will talk about the numbers. Did you want to translate first?
No, I don't
Okay.
know the numbers.
Okay. So let me begin then my small part by talking about the numbers. And so every day at 4 o'clock, we get an update from the prior 24-hour period in terms of number of COVID cases, whether there's new cases, what has transpired with hospitals in terms of hospital stays, and so on. And so what I'm going to report to you is as of 4 o'clock today, and that's a 24-hour update from yesterday. And so today, there are no new cases again today. And one thing I wanted to point out, I don't think we have the bar graph, but we've had 0 cases today to report, and that is true for yesterday and Sunday as well. And so I said, well, let's look back the past 7 days. Let me report out 7 days in a row for the past 7 days. And what we see is that of those 7 days, 4 of the 7 days, we had 0 new cases. And I'm not a statistician or a scientist by all means, but this may just be it's just some anecdotal analysis here of the numbers. So over the past 7 days, 4 of those days, we had 0 new cases. And then the last time we had cases was Thursday, a week ago Thursday. That day we had 4 cases, 4 new cases. Friday it was 2, Saturday it was 1. So going back a whole 7 days, just to repeat, Wednesday was 0, Thursday 4, Friday it went to 2, Saturday this weekend was 1, and then Sunday, Monday, Tuesday was 0, 0, 0. So maybe that's indicative of some of the orders that we've put in place and the community's respect for them and the acknowledgement to social distance, to stay at home, to wash your hands, not touch your face, and to call for help and stay away from people if you feel sick. In terms of deaths, yesterday we reported the first COVID-related death, so that still remains at one death for the county region. The distribution of those cases between male and female is still split pretty much 51 to 49%. And then when we look at the age demographics, we place all the 90 cases to date in an age bracket. There's about 7 of them. or 9 in total actually. 6 or 7 of them have numbers in them. One category does not, but the key message here is that every age group, when you get to the 20-year-old up to the 79-year-old age group, has a pretty equal number of cases. And so the message is that the virus doesn't pick one age group over another. Everybody's susceptible to getting it, and so we all need to be aware and follow the precautions. Now, let's talk about tests, because that's an important subject. Today, the city in our laboratory did not do any test analysis. We didn't have any drive-through, but we will have one this week, and so we'll have more tests done then. But today, we did get 127 test results from the private sector. That's from the hospitals, our primary hospitals here in Corpus Christi. It also does include some new testing data that we got from Physicians Premier, and then several local physicians as well are now starting to report to us. So the total number of tests that have been ordered or done in our Nueces County is up to 1,600 now, 1,637 to be exact, with 127 new cases that were provided to us today by the private sector. And then when we look at who's hospitalized and who's recovered and how many had it and how many don't have it anymore, so that we know of the 90 cases, 16 have recovered to date. That's up 2 people from yesterday, and 74 then are still in the classification of being positive for the case. In terms of hospitalizations, since we've been tracking this, there's been as many as 20 people hospitalized. Today, there's 5 in the hospital, and one of those persons is in critical condition. The other 4 are in regular recovery. And then the final statistic for me is where are the 90 people within the Nueces County? And so the majority are obviously in the city of Corpus Christi, the biggest city in the county. There's 75 persons in the city limits. Robstown has 2 persons, Port Aransas has 7, and then there's 6 in what we call rural or unincorporated Nueces County. So that's an update on the numbers and the statistics that go behind them. Annette Rodriguez now is going to come up and talk to us about the new, or not the new, but the updated and most current testing criteria. And as well, she's going to show you and show the community what we talk about when we talk about the testing procedure, what it means to, and what instruments we use to collect the samples, and then what are they analyzed in. We don't have all the laboratory setting, but we have the devices, these quote-unquote test kits that people have heard a lot about. And so that concludes my portion of today's briefing. Thank you.
En resumen, en las últimas 24 horas no se han reportado casos adicionales por el virus. En la última semana, en los últimos 7 días, han habido 0 casos nuevos en 4 de esos días. Esperamos que esas cifras bajas sean el resultado del distanciamiento social y las acciones que se han tomado. Actualmente en el condado de Nueces existen 90 casos confirmados por el coronavirus. Entre esos, 46 son varones y 44 mujeres. La mayoría se encuentran en el rango de edades entre 30 y 39 años. En total se han llevado a cabo 1,637 pruebas entre hospitales y el Distrito de Salud Pública, así como del sector privado. De los 90 casos, 75 son residentes de la ciudad de Corpus Christi, 2 son residentes de Robstown, 7 son residentes de Port Aransas y 6 son residentes de las áreas no incorporadas del condado de Nueces. 16 de los 90 casos se han recuperado por completo, 20 han sido hospitalizados. Aún continúan 74 casos activos, 5 personas continúan en el hospital y 1 está en condición crítica en el área de cuidados intensivos. Hasta el momento se ha reportado una persona fallecida.
Thank you. Annette Rodriguez, Health Director. So I'm going to go over today a little bit about the testing process and how that works. So the steps are, there's a phone bank, so citizens call in. There's a review to determine if there's a person under investigation. Then it goes to the Department Operations Center. Then it goes through the drive-through collection site, and then to the laboratory, and then the contact tracing starts. So I'm going to go through each one of these. So the testing overview starts with the phone bank. So the phone bank is something that's new, is set up at the health district for this pandemic. And that's when citizens call in and they say, I think I'm sick, I feel like I might have COVID-19, and so we start screening them at this point. So I wanted to tell you a little bit about our phones because we normally have one switchboard operator, and that's all we have. So we set up the first phone bank, had between 6 and 8 people at one time, Then we very quickly found out that we needed to ramp up to 2 phone banks, to 3 phone banks, and then we said we need 5 phone banks. And so all the phone banks going at the same time were between 30 and 45 people answering calls. So the first couple of days when we started noticing these strange kind of calls coming in, not feeling well, felt like they had the flu, but didn't really think it was the flu, so we're like, okay, so something's going on in the community. This was around March the 5th. To March the 8th. So just for a few days there, we had 19 calls that came in, and we actually made 46 calls back out to individuals because they were saying somebody else was sick, and so they were wanting us to reach out to people, so we did that. On the week of March 9th, we had 850 calls to our phone bank and 1,743 calls that we made back out. In the week of March 16th, we had 3,060 calls into our phone bank and 1,032 calls out. And then on March 23rd, we had 1,244 calls in and 468 calls back out. The reason I bring that up is because while we're seeing a little decline in those numbers, we know that the public health mitigation strategies are actually working, which are social distancing, cover your nose and mouth when you're out, stay at home if at all possible. All those things are working, and we can tell the phone bank's, a little quieter than normal. So when we're talking to these individuals, we tell them they need to follow the CDC guidelines, and I've been repeating those CDC guidelines. But the criteria now is such that if an individual has any of these symptoms, so I'm going to go over the symptoms, because it used to be just fever, dry cough, and shortness of breath. So it's fever, and it can be subjective or confirmed, which means you can just say, I feel like I had a fever, like the last couple of days, or you can actually have checked it with a thermometer. A cough, it can be dry, it can be a wet cough as well. Shortness of breath or difficulty breathing. Chills, reporting that you're shaking, but you don't feel like you have a temperature, you just have the chills, the shakes. Muscle pain, body aches, headache, sore throat, a new loss of taste or smell. That's a real interesting one because it seems like what we're seeing are the people that have the loss of taste or smell, they're not as sick as other individuals. So abdominal pain, nausea, vomiting, and diarrhea. So if they have any of these symptoms, it's not a combination of symptoms, if they have any of those symptoms, the reason we're taking them in through the CDC guidelines is because they're in an area of community-acquired transmission, which is here locally. So then this information all goes, that's like you meet the criteria, you have those symptoms, so now we call you a person under investigation, and we sent that information over to the DOC, the Department Operations Center. And we're there, I'm there myself, and we have other administrators, public health administrators, and we're all reviewing the information that's coming in. So once we review the information, we reach out to the state. We give them a little summary of the individual that is a person under investigation. They call them a PUI. And then we schedule them for the next drive-through. So that's how they get scheduled. After they've gone through the drive-through, then we collect the specimens. They're all there in an ice chest, and we bring them back to the health department, to the laboratory. So the sample's received, and it's prepared for testing. They've got to make sure the name, the date of birth, everything is matching. So the laboratory uses what they call the polymerase chain reaction, PCR testing. I think y'all have heard a lot about PCR. So I actually brought one. So the PCR, this is the gold standard for testing. It actually has the Q-tip. And it actually has what we call the VTM, the viral transport media. This is the viral transport media that we're so hard to get a hold of. But you might have this and you don't have these. And so you need to have both in combination to be able to do the test. So this is what goes up into the nostril, and it goes all the way back to the line. So there's a line on there, goes back to there, and then they break it off, they put it in this tube, they close it up, and they put it in the ice chest. So these are called the collection test kits. Because people ask me, are you out of kits? And I'm like, okay, which kits are you talking about? This is the collection test kits. So once the collection has been made, the specimen is then prepped and extracted. And that's done by an extraction kit. So I'm going to show you that. So here's an extraction kit, and we've talked about that we're running low on extraction kits. I think a couple of days ago, we were down to like 42 extraction kits. So these are the extraction kits, and these actually go into the laboratory machine. So, and we need these to actually run the test. These are the extraction kits. So we just received 300 extraction kits, so we're good on kits right now, these kits, extraction kits. So, after the RNA is extracted by the machine in these extraction kits, then they actually pull that out and they put it into a well, a plate. And these plates, this one's a little different than the one we actually use, but this plate, the ones that we use, have 21 wells. They have these little holes, these wells. They actually have 26 wells, but some of those wells are used for controls, for positive, negative, et cetera. And so they put that solution in here. And so at the beginning, and I don't know if y'all remember way back when, but at the beginning we were saying we're running low of plates. That was these plates. We only had like 10. Now we have over 1,000 plates. So we're good on plates. So, and we're good on extraction kits. And I was called this morning, very excited to say that the SOC, the State Operations Center, did say that they have some VTM, so the collection kits, the ones that I showed you initially, the collection kits that are going to be coming to the health district. So we have 500 on their way. So that's exciting news. So thank you to the judge and the city manager for making sure that we have enough test kits and nucleic acid kits to actually run these, and the wells as well. So the PCR machine then runs the samples. And again, this is the gold standard. There's other ways to run tests. This is the gold standard. So this one, it's going to be right more times than it's going to be wrong. So they put that in their nose, and then they run it through the lab. If it's negative, it's real easy. All we do is we call the person and say, you're negative, they're excited, we're done with the process. If they're positive, the case is submitted to the Department of State Health Services, because we're also required, to let them know if we have a positive case. We have to do that within 24 hours. That is the law. And then we start the contact tracing. So the contact tracing, we talked to you about this before too. So the first case, the positive case, we call it an index case. That's the individual that's positive. And then we call them and then we ask them, who do you live with, who lives in your home? We know that those individuals are the most likely to actually come out positive. Then we talk about where do they work, where have they been, what different venues have they visited. So it's a little bit shorter now because it's a stay at home, and so a lot of people aren't going to as many places as they were before. So it's easier for us to get that information and get done. So what happens normally when we're doing the contact tracing is that we find that somebody actually isn't feeling good, and so we start talking, we call those individuals, all the individuals, even if they're family members, we say we need to talk to them individually. So we call them, we start getting their symptoms down, and then the cycle starts all over again. So it's going to start over again. It's a PUI. They're going to go through the drive-through. We're going to collect the specimen. It's going to go to the laboratory. We're going to result out. So that's the whole process from beginning to end from the health district. People ask me every day, so why didn't you run any tests today? Well, we didn't have a drive-through. We'll have our next drive-through on Thursday. But the other response to that is we also do testing for the whole area. So different San Patricio County, Clayburgh County. So we do a lot of different areas around us because we have the Laboratory Response Network. So we're one of 10 in the state of Texas. We actually have what's called a Biological Safety Laboratory 3. So CDC has a BSL 4, and we're a BSL 3. And there's 10 of us in the state of Texas, and so they can all run, these tests. But we also run tests like for nursing homes. So if somebody thinks they might have a positive in a nursing home, or that a healthcare worker may be exposed in a nursing home, or the hospital feels like they may have an exposure at the hospital, we run those tests. But they bring us those specimens, and then every day we know we have certain ones through the drive-through, and then we have others, we call them inpatients, but they're just the others, and they run those tests. So most of the time, on a daily basis, they're running tests. If it's not for our drive-through, they're running for the hospitals or for the nursing homes. But the hospitals also send out their tests to commercial labs and to, to these other places, kind of just because that's the way they've always done it. They have a process for doing it, and so they do that as well. But we're there in case there's an exposure of any type, and we can, run a test and we can get those results very quickly. So now that the guidelines have changed, they've kind of eased up now because it can be any symptoms. Before it was a symptom with fever plus. And so it's these symptoms. We've actually started to see more phone calls in, which is a good thing because we want to be able to test people. We want to be able to know if you're positive or not. What we can't do is we still can't test the whole community. We do not have enough tests to just say we're open and we can just test anybody even if you're not symptomatic. So again, if you feel like you have COVID-19, you can call 361-826-7200 and we will get you through the system so you can get tested. Thank you.
En resumen, la directora del Departamento de Salud del Condado explicó los pasos que se toman al llevar a cabo las pruebas de detección del virus, primero a través de un banco de llamadas, en donde el individuo es cuestionado para determinar si cuenta con los requisitos establecidos por los Centros para el Control de Enfermedades, o CDC. Si cuenta con los requisitos, entonces su caso es llevado ante un supervisor. Posteriormente es llevado ante el área de pruebas para tomar su espécimen. Una vez tomada la prueba, se envía al laboratorio ya con los resultados, se reporta al CDC. Si la persona resulta positiva, se realiza un rastreo para determinar cómo es que la persona se contagió. Después, las personas que estuvieron en contacto con esa persona contagiada, si existe alguna persona que tenga síntomas, entonces comienza el ciclo nuevamente. El próximo día de toma de especímenes va a ser a finales de esta semana. El Condado de Nueces cuenta con uno de 10 laboratorios certificados en el estado para realizar este tipo de pruebas. Si usted tiene alguna pregunta, puede llamar al 826-7200.
Good afternoon. Barbara Canales, Nueces County Judge. And this afternoon, I'd like to recap the orders that I signed yesterday and then also pivot to some new guidance that we received really within the last hour and a half from Attorney General Paxton and Governor Abbott regarding houses of worship. I think you're going to find important and interesting. So yesterday, I signed an order aligning the Nueces County emergency orders with Governor Abbott's emergency orders issued Friday, April 17th. These orders begin the process of reopening the state of Texas in phases while revising hospital capacity and certain social distancing guidelines, and we are mirroring those in Nueces County. Again, to review, my orders cover two major categories: hospital capacity, non-elective surgery that goes along with it, and allowing non-essential businesses to operate safely. Let me stop here and tell you that I've had the pleasure today of speaking with all three CEOs of our major healthcare providers, HCA, Christus, and Driscoll. I did this because I wanted them to make sure they had a copy of the orders and that we had a good discussion about what this new normal looks like with elective surgeries in their hospital. I will tell you they were very relieved. There are many children in Driscoll Children's Hospital, for instance, that are waiting for these surgeries to take place. And even though they're not life-threatening, they're still important surgeries. And so I think that this is going to be good for our community, and I think we've also had the appropriate time for all three healthcare providers to make those appropriate, venue spaces appropriate for this type of situation where we're always vigilant for any type of contagion, but of course with COVID-19. In addition, the retail to-go for select businesses is very new. And although I haven't had the opportunity to see any of the retail to-go, any of the curb pickup, I look forward to being a part of the recovery. And so I'm going to be looking out for websites and for opportunities where we can look for businesses that are taking advantage of their curbside pickup or the delivery to your home. I know I was thinking about flowers. Tomorrow is my daughter Jackie's birthday. And you know what? I've got to make certain that I get flowers. And I've got to know which places can do that curbside pickup. So that's a great example. So if you're offering great opportunities in that type of service, whether it's balloons or whether it's birthday cake or all the things I'm thinking about. By the way, she's 21, she's not a little girl, but it just feels good to talk about balloons and happy things tomorrow. So I want you to know that those are two important ways that we're pivoting. I also want you to know that I've received a lot of information and phone calls from concerned citizens citizens about why can't I just open up all the businesses. I really need us to really, as they say, learn a little civics along the way. I know that it's always good in reinforcement for me, and that is the governor's orders are the ones that supersede mine. Let me say it another way. The governor's orders are more important than mine. Those are the ones that we follow. I can be more restrictive, but I cannot do less than what the governor has already ordered. So we're going to follow what the governor's orders have said, and that's still only 2 exceptions, the ones we made yesterday. You're either an essential business or you're not. But if you're not, you can now do retail to go. It's also important to remember that the governor has given us this opportunity to open up the hospitals, but there are some rules, and the hospitals are fully aware of them and they're following them. And that has to do with the 25% of capacity reserve for COVID, and also 25 to make sure they have appropriate PPE, or that protective equipment. So those are the things that happened yesterday. That's a good recap, and I hope that that provides you some guidance. Now, this afternoon, I received some further guidance from Attorney General Paxton, as I'm sure all the county judges did, and this is specifically applying to houses of worship. And I think that we know that houses of worship have been deemed essential, and the government must give the special consideration when we issue orders within this crisis. So because they're essential and because we need to give special consideration, they have issued a few items that I will reiterate, and then I want to share with you what I'm doing to help make this widespread in knowledge. First, houses of worship should conduct as many activities as possible remotely. We know that, and we've been doing that, and we really thank our faith-based community for all of the innovative opportunities they've given to people of faith to worship remotely. And they should follow federal guidelines when providing services in person. Houses of worship should help slow the spread of the virus, and these guidelines do not violate the religious liberty of houses or worship. So none of these guidelines violate our First Amendment rights. And this has been declared, again, by the Attorney General of Texas. So I think that it's important that you know at home that I have already started to work this afternoon with area religious leaders to ensure that these new guidance and the guidelines are widely understood. And so within a short order, I think you will see that we will provide from Nueces County's office and the Office of Emergency Management some guidelines for our clergy. So if you are essential and you can practice the federal guidelines and you can create some great protocols that we can share as a faith-based community, we might be able to see services come back into action. I'd like to absolutely stress that it's imperative that we lock in our gains. Let me say that again. We lock them in. We put them in a vault, never, ever to be lost. All of the pain that we've gone through the last 30 days, the economic catastrophes that have occurred to so many of our small businesses, our personal sacrifices and our personal pain, staying away from loved ones and creating a whole new world order. None of this should be in vain. And the way that's going to happen is when we pivot like this, to do something we're dying to do, something we're craving. There's a hunger in our hearts to get back to church, and I acknowledge that for myself. And so I certainly acknowledge it for all of you. But as we pivot, these protocols are going to be imperative to keep people safe. So as they say, give an inch, take a mile. Let's not do that. Let's give an inch and take an inch. Let's really do that. And then we can get back to worship in a proper way. So I've asked for some guidance and some help. I reached out to Bishop Mulvey from the Catholic Diocese, and he's going to start those conversations. And I reached out to Pastor Bill Cornelius of Church Unlimited, given that he has a tremendous following and a very large congregation. And he's going to be reaching out to lots of other ministers that I already have been talking with over the last few weeks. And we're going to create an opportunity to create a new norm for worship services. And I hope that you will find this to be a good thing as we're seeking input, and we will have these further discussions through these press briefings as we create these protocols together. Again, and something else that's sort of breaking news is that within the past hour, the United States Senate approved additional funds for the Paycheck Protection Program, affectionately known as the PPP, not to be confused with the PPE. This is a $320 billion addition. Let me say that's a lot of money. It's a $320 billion addition to the $350 billion already distributed to lenders. I have not had a chance, because it literally just happened, to read everything, but the spending bill, as I understand it, is expected to be taken up on Thursday by the House of Representatives, and then the president is expected to sign this bill into law as soon as he gets it. So this is good for Texas, and this is good for our community, that we will have additional refuge and relief for our businesses through this additional funding. We remain vigilant in our office to monitor all updates, to bring them to you here, to allow you to ask questions of us through our hotline, which is being maintained by so many good people, and I want to thank them for that. Today, as this morning, I had the opportunity to go into radio and say something that I'm going to really try to say at the end of every press briefing. At Commissioners Court, we always try to leave in a different spirit, which is a selfless one. And so I want to say that today I'd like to say thank you. Thank you to all the teachers of all the independent school districts in our region. I want to thank the principals and the superintendents and all the administrators. You know, school might be physically closed, but it's not closed for learning. And I want to thank all of you, because you don't get thanks enough. And it's been a tremendous challenge to continue the education of our children during this difficult time. And I also want to thank the care workers, the child care workers, that are another first responder of a different kind, who are taking care of the children of our police and our firemen and our healthcare workers. And so I'd like to leave you with those thoughts, that while things are always best seen from a lens closest to us, that is our own personal world, I'd ask you tonight to say a little prayer and think about people like our school teachers, who have had to completely adjust to a whole new world. And while that safety net is not in an edifice, that safety net still exists, and it exists within our teachers' abilities to continue educating our young people. And thank you to the child care workers who allow us to do our jobs in the world of first response. Again, I want to give my thanks to our federal partners for understanding that we are hurting here in the Coastal Bend, along with so many of other counties throughout the state of Texas. And we look forward to helping our small businesses through our regional alliance and our project Code Blue, reviving the South Texas economy. And just remember, nothing we have done is in vain if we can make certain that we can lock in our gains and make certain that we continue the practices that have been learned and now memorized. Now it's time to create muscle memory. We've learned it, we've practiced it, and now let's create that muscle memory. So as we pivot into opening Texas businesses and those here in the Coastal Bend, that we not give up any of the good work that we've done. That zero means something. You did that. Let's keep it up. Thank you so much.
En resumen, la juez del condado quiso resumir las enmiendas a las órdenes establecidas anteriormente. Ayer se enmendaron las órdenes que reflejan los cambios establecidos por el gobernador. 2 de esas enmiendas son las cirugías selectivas que se podrán realizar siempre y cuando haya espacio en los hospitales, y la reapertura parcial de las tiendas en los negocios que podrán entregar sus productos afuera de sus establecimientos. He recibido muchas llamadas de personas que quieren ya abrir sus negocios. Quiero que sepan que las órdenes del gobernador tienen mayor autoridad que las mías, por lo que se tienen que seguir. Por parte del Procurador General, en cuanto a lugares de oración, las iglesias pueden realizar actividades de manera remota y deben de seguir las reglas federales. Esas reglas no violan nuestra primera enmienda. Esta tarde he estado colaborando con líderes religiosos y clérigos, ya que es importante que no olvidemos todos los sacrificios que hemos hecho hasta el momento. Esta tarde también el Senado aprobó fondos adicionales de $300 millones adicionales a los 350 ya designados a los bancos para realizar préstamos. Una vez que se firme una ley, los negocios tendrán fondos adicionales como ayuda económica. Hoy quiero darle gracias a los educadores, maestros y superintendentes que han logrado un reto, así como a los educadores de menores que nos han ayudado a que continuemos con nuestras labores.
Good afternoon. I'm Mayor Joe McComb. I want to say how much I appreciate the judge and Peter's hard work in all of this, and we're getting there. We've been working as a team, and I think we continue to work as a team to make Corpus Christi and Nueces County a successful effort in this COVID fight. While they've been focused pretty much on the health side of it and working with our medical people that have just done yeoman's work and dealing with our community and helping those that are affected, they've also had staffs working on their other issues. And what some people may have, I don't think they've ignored or forgotten, but it's kind of been on the back burner, is that we're really Corpus Christi, Nueces County, we really got hit with a trifecta on this situation we're in. One, we've got the COVID virus issue that we're dealing with, and then second, the oil and gas turn down that has been significant, and I don't believe I've ever in my life or even read about where the price of oil goes into a negative factor. But yesterday that happened, and so that's going to have a significant impact on our community and the jobs that we have here, and it's also going to have a significant impact on our budgets, both the county, the city, the school, and everybody else. And so we asked last week the city manager to come forward to bring us a financial analysis of where we were. We've into the third quarter now. We just finished the second quarter in March, and he did that, and I wanted to share some of that information with the public so that they would understand that we're not just dealing with trying to how we resolve the coronavirus issue. We're also dealing with a financial issue with our city, and the judge dealing with the same issues at the county. But this is where we are with the city's budget at this time, and so you will have some idea of some of the issues that we're fighting with. But if you understand that the city's general fund, and that's the one that really is paid for by the ad valorem taxes, which is your property taxes and basically your sales tax, with people all in their houses, there's not much sales going on. And so we anticipated that we would see a significant reduction in sales tax, and that has come to pass based on the prediction that the city manager presented to us today. We're forecasting, at least he's forecasting, and the staff and the council heard this morning, that the general fund revenues for this year, on the best case scenario, could be about $14 million short. On the worst case scenario, could be approximately $21 million short. But hold on, don't gasp for air right now. There's better news to this story than it sounds. But I think what you'll see is that what the actions by this council have done in the past and under the leadership of Mr. Zanoni in the time that he's been here, we're gonna come out of this all right, but it is gonna take some good management decisions and the council working together to make sure that we make the right decisions. But for instance, to give you some impact on the sales tax, right now we're looking at a projected shortfall on the best scenario is about a $9 million shortfall in our sales tax and about a $13 million shortfall in our worst case scenario. But, and that's a result of people just not being able to go out and buy. And so when we get back to freedom again and not being in our homes, and we can get out and get back to activity, but then that's still going to be impacted because many people have been out of work for a month or so and they don't have the money to go spend. So the sales tax is not going to rebound quickly, but that is something that we're factoring in. And one of the side effects that we don't realize sometimes, we just don't think much about it, is that, well, there's a domino effect in this. In other words, another part of our budget, which is our solid waste, we think, well, that's a pretty solid business, solid waste, makes good revenue. Well, it does if there's a lot of garbage to pick up. but then you understand that a lot of businesses have been closed, a lot of restaurants have been, many of the restaurants have been closed, at least to the volume that they normally produce solid waste. And so the revenues for the solid waste department is down. So different departments within the city that are revenue generating have taken a hit also. And so we've got to be extremely careful in what we try to do to help face this revenue, but with the revenue shortage. But the city manager at this point has given us figures that based on some of the reserves that we have, because this council has been pretty strong on saying we're not going to spend down our reserves. We never know when a storm is going to hit. And that training has come from the past of having hurricanes periodically. So we understand storms. I don't think we understood a pandemic. But anyway, those reserves are in good shape. And so on a once-in-a-while situation, those reserves come in to really kind of protect us when a real disaster hits. So the good news is that at this point, the manager is not recommending or does not foresee any reduction in full-time staff at the city. Because of our financial condition, we're in good shape. The financial advisor that we have, I think, made the comment that he's never seen the city in such good financial shape. And so that's a tribute both to Mr. Zanoni and the council will take a little credit for hiring a financial advisor that we look to and we depend on and get his advice. And we're also going to be taking advantage at some point to go in and refinance some bonds at lower interest rates and to try to get us through this crisis. So we're going to need your help, need your support, but let me assure you that the council is committed to getting us through this in a financially sound way and keep this city moving. Just a couple of words of advice. I know you get many emails on a daily basis, some of them, most of them from people you know, others you're getting new emails from on a daily basis. In the mayor's office, because we're a public entity, and my email and I guess council's emails and all are public information. I don't know how many the council members get, but I'll get somewhere between 100 and 250 emails a day. Most of them are from vendors trying to sell the governmental entity something. And so this situation we're in with the COVID is no different. We've gotten new kind of emails coming in from all kind of scams trying to sell us the latest and best and immediate cure for masks, for tests, for everything else. So be careful of scams going on. I wouldn't, if you don't recognize an email, I'd hit your delete button, and if they're serious about getting back with you, they'll figure out another way to do it. But if you're getting phone calls from people that just got the latest and greatest bells and whistles that's going to solve your coronavirus issue, just say thank you and hang up. Don't be taking calls that you don't recognize who they're from or what they're trying to sell you, because these are some scams, and we don't want you to be taken advantage of. And just to continue to remember that you have fellow citizens in this community that are hurting. They have been without work for, could be now 2 months. Their finances are there. There's organizations throughout this community that are trying to help people, provide food and provide utility payment assistance and this sort of thing, and we're continuing to do that. And the firefighters, while they've been out on the front lines and providing service, that they've also the last couple of weeks, when they've come to work after they've been off of their shift, when they've come to work, they've been bringing some canned goods to the fire departments. And just today, they delivered 976 pounds of food to the Coastal Bend Food Bank. So they're not only being your first responders, they're being first-class citizens and trying to help their fellow man in this community. So we've got a good community. We're pulling together. You've been wonderful. I think the judge will verify this and support this statement that the community as a whole has been wonderful in responding to our regulations and the rules that we're trying to implement to maintain that you've got your health and safety maintained, and we want to keep it that way. And we're going to ask you to continue to follow the rules as we look like that we're beginning to ease our way into getting back to work. It may be a new normal, but I can tell you people would rather have a new normal work day than no work day. And so I think people are going to be very cooperative and very responsive to the rules and regulations that are imposed. The Restaurant Association has given the governor an opportunity to look at what they're proposing, and to me it looks like a sound plan, and I hope at his press conference on Tuesday, I believe it is, or maybe it's Monday of next week, Monday or Tuesday of next, 27th, Monday, he is supposed to lay out his plan for the future, and I'm anticipating that to be one of trying to put us back to work. And I would suspect that that plan that the Restaurant Association has proposed is going to be one that works, and that would be a wonderful news for the community. So things seem to be moving. They seem to be moving good. We're delighted that we had a zero number of positive cases today. As the judge said, zero is a good number in some cases, and so it's that's a good number we're looking for. So we want to say thank you again for the work that the community's done. Again, thank the judge and her staff, Peter and his staff, and our first responders and our medical people that are out there. We're going to get through this. I think the scripture says, crying and weeping endures for the night, but joy comes in the morning. I think morning is just around the corner, and so we're very optimistic, and we're gonna be a better community for it. But we got to still pull together. The game's not over, and so that's what we're trying to do at the city council level, and we'll continue to keep you informed. And that concludes my remarks. And I'm assuming if you have some questions that the judge or Peter will come back up, or Annette will come back up to answer any questions. Do you have any closing comments, Peter? Okay, so thank you. We're almost there, but hang tight. We've got a lot to be proud of. You've done a great job, but we're not through it yet. So, Peter, if you'll come and close us out, and then we'll have them ask questions.
En resumen, quiero agradecer las labores del administrador de la ciudad y de los empleados de salud, así como a los empleados del condado. Sabemos que el precio del crudo va a tener un impacto significativo para todos, en especial para nuestro presupuesto. Así que no solo lidiamos con el virus, sino también con la situación financiera. Se pronostica que los ingresos de este año fiscal van a estar cortos por más de $10 millones. Tendremos que tomar algunas acciones para poder remediar la situación. Hasta el momento no se pronostica el recorte de empleados de la ciudad y estamos trabajando para poder así evitar recortes en todas las áreas de la ciudad y continuar con todas las operaciones. Entre otras notas, queremos evitar las estafas. Las estafas han aumentado en todo el país durante la pandemia del coronavirus y tenemos información que creemos que puede ayudar a los residentes. Ignore las ofertas en línea de vacunas y kits de pruebas en el hogar. En este momento no hay productos probados para tratar o prevenir el coronavirus. Cuelgue a los estafadores que usan llamadas automáticas ilegales para ofrecer todo, desde seguros de salud a bajo precio hasta esquemas de trabajo en el hogar. El día de hoy también el Departamento de Bomberos realizó una donación de 976 libras de alimentos al Banco de Alimentos del Área de la Costa. Durante las últimas 2 semanas se pidió a los empleados del Departamento de Bomberos que llevaran productos enlatados a varias estaciones de bomberos. Finalmente, el alcalde dijo que le da gusto no tener más casos por el virus y quiere agradecer a los residentes y a los elementos de emergencia por todo su trabajo.
Okay, great, thank you. So that concludes our joint Nueces County, City of Corpus Christi briefing for today. Just to keep us going forward, tomorrow is Wednesday, and County Judge Barbara Canales in the Commissioners Court will have a workshop and then at their regular business meeting, so that's something the community might want to stay tuned to. Tomorrow, as part of our press briefing, as part of my comments, I'll remind the community what City Council approved today for more small business loan assistance dollars. And they also approved funding from the federal government that was supplemental money given to us because of the CARES Act. And Council approved awarding those dollars today to help residential customers with utility and mortgage and rent payments and other items. And so we'll highlight those tomorrow, just given the amount of material we covered today. And so those are 2 big things for tomorrow. We'll be back Thursday. We'll be back here tomorrow, but we'll be back Thursday with the 2 elected officials, the county judge and Mayor McComb will be part of our press briefing on Thursday. And Thursday morning, we'll have our drive-through testing as well from the health district. So with that, we'll take any questions that you might have for this afternoon.
Feels like a spelling bee.
Yes, sir.
Just to clarify, when it comes to getting back into actually having services, is there a date where that might happen, and what might the services look like? Can you give us an idea how those discussions are going with the clergy?
Sure. Well, the date, could be as early as some people do have Saturday Sabbath services or Sunday. What it's looking like are some really great, thoughtful, socially responsible as well as religiously responsible protocols. Things that we talked about today were when you walk into church, you would be asked to sanitize your hands. When you walk out, you would be asked to sanitize your hands. I know at my church we have books, right? We have both hymnal books and we have Bibles. And the things we discussed today were everyone has their own phone, and there's a Bible app that can be utilized, or you could have printed readings that would be disposable at the end of the day or the end of the Mass. We talked about those communion kits that are self-isolated and absolutely nobody else has to touch. We talked about wearing gloves and masks to distribute communion at some time maybe in the future where there would be social distancing as well. We talked about families sitting together, but let's say the cathedral has 2,000 room for 2,000 or Church Unlimited has room for 2,000, but what would the appropriate percentile be of that occupancy in there? It's certainly not 2,000, but if you're your own family, you might be you can still sit together, and then you might have a pew, if you're using pews, completely blank, and then, to create the social distancing inside this framework. We talked about having masses that were extra, where, you could put vulnerable populations away from non-vulnerable populations. We talked about situations that, to me still make sense, which is, first of all, if you're sick, it's just like work or school. Do not go to church. You should not be going anywhere if you're sick. You should be staying home. And so we want to emphasize that. We want to emphasize all the good hygiene. We even talked about making certain that bathrooms were not going to be overflowing, so that you would there's one person, creating limits to areas where people normally congregate. We must have talked, for a good 40 minutes with one clergy, then I had another conversation with another. I, who can talk a lot and have talked a lot my whole life, I am exhausted of talking. I mean, I've really tried to think of all kinds of ways to assist the houses of worship. I know how much it means to the community, but I have to tell you, this responsibility of keeping people safe is absolutely paramount in my mind. And if I had to, to me, the trade-off is that we all work together. And what I'm grateful to be able to share with you is that the clergy that I've worked with wants to work together to figure out how we can do this. So how quick can they do it? As quick as we can kind of get these protocols. We kind of talked about maybe by Friday being able to release something, that would have this guidance, so everybody would have time. But you know what? If it's not right for you and your church, I'd say wait, because what you want to do is be ready. You don't want to rush it to fail. You want to have success. So we want to make sure that the churches, we talked about sanitization after every Mass, having somebody come in and clean and wipe down. It's going to be a lot of work. It's going to be a lot of resources, but it's also a time for stewardship, and it's also a time for fellowship, and I think there's ways that we can work together to do that. I am going to still encourage to do online communications with houses of worship. Why? Because there's a lot of people that are in that vulnerable population that should and could decide to stay home and worship from home, like we've been doing for the past, 6 weeks. So I think the governor's guidance is very clear. It says, when you can be remote, do so. If you're sick, stay away. Follow the CDC guidelines. So there's a lot of responsibility that I'm about to pivot from, or transfer from my hands to their hands. But I know by working together, we can create this. So I will say that I'm working as hard as I can. This is not the only avenue. When I walked back, one of the councilmen said, let's work with the restaurants, let's work with the hospitality industry to do the very same. And I shared with him already on it, sir, and we are going to do that. We're going to create, I'll shoot from the hip. My team's about to kill me here, but I'm already thinking about a recovery task force. I'm watching best practices everywhere. I noticed that Harris County, I think it was just today or yesterday, named a heck of a task force for recovery. And they put the former, I think, Shell CEO in charge, okay? I want to do that too. I want to create a recovery task force so that every industry has the right protocols so that we can open business safely. Because if anybody thinks that today is, what day? Tuesday? I lose track. Tuesday we have COVID and tomorrow it's not here, that is not the case, folks. We have it, and it's in our community, and we still have to be vigilant. So just because we open things doesn't mean we can let up on things. So I'm going to have these partnerships across the board, but different industries need different things. So the restaurant industry, for instance, is talking about things like removing salt and pepper shakers and using, disposable condiments, right? We're talking about disposable menus. We're talking about every other table. Houses of worship, the reason it's different, that I have to get on it first, is because they were deemed essential, where restaurants are working on a drive-through only right now. Does that make sense? So it's a tremendous amount of input that we're looking for, and I don't expect it to be a one-size-fit-all for everybody, but what I am going to try to do is make certain that we have enough protections so that I can look Miss Annette in the eye, and I know that her drive-through didn't just escalate because we had service. That 0 is where I want to hang. I want to hang right there. And I want to make certain the people that are ill get recovered, and I want to keep us there for as long as possible. And I think that's really important. I have a balancing act to weigh, and it's people's lives in the balance. So it's got to be that the trade is a good one, but I know because of the responsibility of the leadership that I have sought, that we're going to come up with some good protocols and rules, and we're going to monitor. And what are we going to do when it's not working? We're going to shift back. But I know that if we do this right, and I'll be seeking the guidance from Dr. Ram as well, because he understands where this virus lives. So I might not think about, for example, choir, sharing choir books, right? Sharing surfaces, touching lecterns, wearing masks. All these things are just paramount to these social gatherings as well as our houses of worship. It's both. So I hope that answers cumulatively everything I have in my brain at 6 o'clock. It gets overloaded upstairs, but it's because we're working on overtime to try to get the clergy the answers they need, given this came out this afternoon.
Are there any other questions? Okay, that'll conclude today's briefing. Thanks, everyone, for coming.